next speaker should be known by most of the people in this audience. He has stood by us for a long time, and I think most of us understand his dedication and support. We're going to bring up here Tom Hayhurst. Let me give you a little bit of an introduction, if I may. Tom, of course, has been a volunteer at Matthew 25 for years and years. He is one of the co-founders of the Wolf Lake free health clinic up there. That's a new program that they've got off the ground. It is truly dazzling. He's done a heck of a job getting that thing started. It shows, too, his understanding of the needs that we're talking about with health care. Of course, Tom is a pulmonary physician, had been for years, and is recently retired. He also had volunteered to go down to New Orleans during Katrina, and that was quite an experience as well. I'd like to bring up now, if I could, Tom Hayhurst.
I'll get lower.
Get down.
Get down. Hey, I'm really impressed. I'm really impressed by a hell of a lot of activism here in Fort Wayne, Indiana, Allen County, Northeast Indiana. Give yourself a big hand. I think it's great. You know, the silent majority, and a lot of you have not been silent, I realize, but more and more are here right now. I think the silent majority is represented. This is the tip of the iceberg of folks that feel very strongly about this particular issue who've come out today. So, congratulations on the activism. Let's keep it up. You know, I've been a medical doc in this community for a few years, I'll put it that way. And I have seen firsthand what the statistic you hear. This is a federal agency, independently says 18,000 people die in the United States of America every year because they don't have affordable health care. 18,000. I've seen it right here in Fort Wayne and Allen County. I can picture one man sick for a week, no health insurance, taking his kids' expired antibiotics, worse and worse, sort of crashing into the emergency room in a critical care unit, dying in 24 hours. I know absolutely if he just had some health insurance, to cover the basics, he would have sought care a lot earlier. I've seen several cases like that. I think it's a real thing. I think that 18,000 number is true. It's a travesty in our country that situation exists. We need to straighten that out.
Yeah.
Also, with regard to somebody going to the emergency room, the cliche that all of these people parading around here will tell us is that anybody can go to the emergency room. Well, that's true. You can walk through the door. You may come out with a bill of $5,000. If you're sick enough and you go into the hospital for a week, you may have a bill of $40,000. And for all those people parading around us, I want to remind them, they will come after your house, they'll come after your car, your truck, and they'll come after your dog to pay those bills. So, and that's a travesty here in the United States of America. We can't just reserve health care for people that have money in their pocket. We need to make sure all Americans have affordable health care. We've had an experiment going on for 40 years. It's called Medicare, and it works. Medicare works. Talk to anybody on Medicare. It's pretty hard to find anybody that doesn't think it's great. 42 million people on Medicare. We've got a lot of the bugs, you might say, worked out. It's a good, solid system. Needs some adjustment, but at least we have the foundation there. Medicare for all makes total sense to me. That's what we need in the United States of America. That's what we need to get done. And whatever happens, whatever our Congress votes, whatever the final plan is, and I think we are going to have a plan. We must demand we do have a plan from our House, our Senate, signed by the President this year. Whatever that plan is, the House and the Senate both need to allow individuals that believe in single-payer health care to at least come forward, state their case before Congress. There are hundreds of thousands, literally millions of people that believe in exactly that. Their case needs to be stated before Congress rather than have literally both parties block that viewpoint being expressed. So that needs to happen, absolutely.
Yeah.
Now, I've been a member of the AMA in the past, and I think I heard the AMA mentioned in some national medical organizations. An AMA rep was in Fort Wayne a while ago, and he said, you know, the physicians in the United States of America, and this is true, we have decided in the AMA, you might say the physicians union, has decided we would rather deal, physicians in the U.S. would rather deal with the United States government than deal with health insurance companies and their dictatorial policies that are designed to just fatten up the kitty. And one other thing I want to mention, and that is that we're hearing shouts from behind us and in front of us and on television about getting the government out of health care. I think that's a travesty. A guy came up to me a while back and he told me that, I want the government out of health care. I said, well, where do you get your health care? He had a little gray hair. I said, where do you get your health care? He said, I'm a vet. I go to the VA. It's great. They'll hospitalize me, meds, very economical. I've got a family doctor. It's great. I said, that's like British National Health Service health care. Nobody's even talking about a system like that. But it is the government running healthcare, running it extremely efficiently when it comes to dollars spent, when it comes to quality healthcare. These folks that are saying they want the government out of healthcare, I want them to hang their head and ask forgiveness from every veteran in the United States of America, because they're telling veterans, we don't want the veterans of this country to have health care from the government. That is a travesty, terrible thing to tell our vets. They can't say we support our troops and to hell with the veterans. They cannot see that. Let's not let them get away with it. I'm a veteran. I'm very emotional about this, and I'm glad I am. The government has done a good job providing health care for our vets, and it needs to do a better job. And those folks that say get government out of health care, they are totally wrong, especially with regard to veterans. So I'm proud of all the activists that are here today. I know every one of you is connected with 10 or 50 or 100 or 1,000 other activists. So let's keep stirring up the pot, get the word out. Affordable health care for all Americans. We got to get it done this year in some way. Thanks, everybody.